Well, greetings, friends and followers. This is Nurses Talking. I am Del Barzi. As always, if you like what you see and hear, leave us a comment, subscribe, let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anywhere in between. And today it is my great pleasure to welcome Dr. Jose Arnold Tariga. Arnold, or also known as Dr. A, is a nurse with more than 15 years of professional experience in various clinical and educational settings in the Philippines, the United Arab Emirates, and the United States. His areas of expertise are education and training in clinical and academic settings, as well as nursing professional development. He has a background in acute and long-term critical care and healthcare quality. His areas of interest include competency development and assessment, workforce upskilling, educational program development, implementation, and evaluation, professional development, and educational research. His personal philosophy is to grow himself continuously so he may help others succeed. He envisions himself as a leading advocate for creating a safer healthcare system manned by highly skilled and competent healthcare professionals. And his personal mission is to help mold highly competent nurses through evidence-based and competency-based clinical education, as well as continuing professional development. Dr. Tariga, Dr. Arnold, Dr. A, thank you so very much for doing this.
Thank you so much, Dale, for giving me the opportunity to join you here at Nurses Talking.
My pleasure, my pleasure. But first thing I always want to know is why people are nurses. Why are you a nurse?
Why am I a nurse? That's a very interesting question, if I have to be honest, because I was one of those who was really scared to go into nursing school based on what I've heard from people. Because, you see blood, wounds, and stuff like that. So I think when I started nursing, I sort of started it because that was the trend during my time in the Philippines. The year that I was about to graduate high school, they said that, nursing is a good pathway for you because it will open up opportunities for you to go to the United States, to reach your American dream, because that's like a very big concept back home. So started it not necessarily loving it at the first time, but then the more I get exposed to nursing school and the more I get exposed to the hospitals during my clinical placements, I've realized that nurses are doing a lot. We are impacting lives of the patients, and even the family members as well. So
yeah.
I eventually fell in love with it, I think, on my second year. And since then, I have been so passionate about nursing, and eventually in my career, I also became passionate about nursing education because I wanted to help mold the next generation of nurses. And here I am now, I think, working as a nurse educator generally, but on different roles.
Yeah, this is a big thing. But you were scared, first of all, and then it took you a while to climatize and fall in love with it. What, between being scared and falling in love with it, what were the challenges there?
One of the challenges is really, I think, there's a very different concept of what nursing is. When you talk to people who doesn't have an idea about what nursing is, they will always think that nursing is doing the dirty job. You clean people up, you change diapers and stuff. But it's actually beyond that. Once you go into nursing itself, yes, that's part of the job, to help people who can help themselves at the time that they are sick. But actually really, critically thinking on how you can help this patient be well from being sick. It's not just a dirty job. It's caring for the patient holistically, caring for their physical aspect, their emotional aspect, their psychological aspect, to make sure that they go out of the hospital as a whole, Yeah. So I think it's the holistic care that we provide that really sort of made me fell in love with nursing.
Yeah. And you just so adequately articulated really one of the goals of this channel, because one of the goals is that, I want nurses to see nurses, but I do want the people that we serve to see us as more than just the people who do for that dirty job is, because that dirty job really is a small part of what we do.
It's a very small part of what we do. Yeah. So yeah, if you really know, if you see what nurses are doing behind the background, you will be amazed as to the many
Yeah,
things that we're doing, even beyond the role that we are hired for.
yeah, and what it requires. So you worked in a few different areas.
I did. So when I finished my bachelor's in nursing, I immediately worked in the community nursing, sort of like a volunteer job in our community health
Okay.
unit in my community, and then eventually moved into a bigger hospital setting. So I started as a medical surgical nurse, but then I really wanted to specialize. So I moved into the intensive care unit as a critical care nurse for quite some time. Um, and all the while I was doing my postgraduate studies because I also wanted to grow my
Yeah,
profession. But I think at one point, Dale, in the Philippines, there's really not a lot of resources and I would say opportunities for professional growth.
yeah.
So I started looking out for other opportunities outside the country, and that is when I bumped into an opportunity to move to the United Arab Emirates. So when I moved in there, I started working as a bedside nurse in a long-term care facility. But it was mostly on ventilated patients, so still sort of
Okay.
aligned with my critical care experience. And then also moved into post-acute rehabilitation. And all the while, I was navigating the different ladders of professional development,
Yeah.
worked eventually as a charge nurse, but I would say that nursing leadership didn't work out well for me while I was in the Middle East. So eventually shifted into education as a clinical educator. And I realized that I found my niche in nursing. I was like, I love teaching my fellow nurses, sharing my knowledge. So since then, I invested a lot of my energy and effort and time to grow myself as a nurse educator. So, yeah, worked as a clinical educator and then also did some healthcare quality because I strongly believe that healthcare quality, the data that we gather in the clinical area is also very much aligned with what nurses
Mm.
educate do because that is the focus then of what we will be teaching or what we will be educating our nurses. And then did some part-time gig as a professor in the academia in one of the universities there in the Middle East. And then eventually there were a lot of challenges as well, which I'd like to share
Sure.
later,
Sure.
that I went through as a person of color, as a person of a specific nationality, as a non-Western trained nurse. Um,
Hmm.
that sort of limited my ability to grow farther in my career in the Middle East. And that was when I realized that I need to move to another country that will recognize not just my nationality or um, other things, but will consider me as a professional with experience
Yes.
and qualifications.
Yeah.
And I've heard a lot of good things about the United States. I have a lot of Filipino friends and other nationality friends who have moved to the United States and has said that they have a lot of opportunities in there. So
Hmm.
out my NCLEX exam, passed the NCLEX exam, and then moved here just very recently. Actually, I just moved here last year.
Okay.
Yeah, and so far I would say things have been amazing. A lot of opportunities have presented itself, and I would say that currently I'm at a place in my career that I'm really happy with what I'm doing. I would say I'm not so sure if you're familiar with the term ikigai, or
Yes.
life purpose.
Yes.
I would say retrospectively that I have found my ikigai because I really love what I'm doing, and I feel like I am impacting not just myself but the community that I'm working on and the fellow nurses that I'm helping out in my current role.
Wow. That is huge. That is huge because whether people know the term ikigai or not, many people go through a whole lifetime without ever finding it. Finding
Exactly.
it. Yes.
Exactly.
So that you have found it, it is huge. You're giving me goosebumps right now. So the biggest, um, what would you say though, in all of these places that you have worked, what would be the biggest difference?
Um, I think I look at it from a perspective of the different countries that I've worked. So when I
Mhm.
was working in the Philippines, one of the difference and sort of like a challenge is really not having a lot of resources for
Mhm.
nurses. and the opportunities for professional development. So
Growth.
yeah, so when I was in the Philippines, and I'm not so sure if this is just my experience, but when I was looking into which pathway I'm gonna go, the pathways are so limited, Dale. Like, it's either you work in a hospital and you go up the ladder of leadership, like become a charge nurse, a manager, a supervisor, and then like go up higher, or you either go into academia as a clinical instructor and then go to the different levels of professorship. So when I moved to the UAE, that has always been my mindset that since at that time I was not necessarily interested with education yet,
Yeah.
I'm gonna go to the leadership pathway because I didn't know that there are other subspecializations, like hundreds of subspecializations here.
Yes.
So, um, so now when I moved to the Middle East, follow that pathway, and one of the challenge that I really experienced, the biggest challenge, is in the Middle East. Like there's this, I think, for lack of better words, there's discrimination in terms of nationality.
Yeah.
As an Asian, as a Filipino, when I apply for opportunities, a lot of opportunities closed because they will always say that you're not Western trained. And it did happen in my career, Dale. I worked very hard to become a charge nurse because again, that was the pathway that I was like leaning on.
Yeah. Mm-hmm.
It took me 2 years to become a charge nurse as opposed to my counterparts, Western counterparts. So it only took them like 6 months to be promoted.
Mm-hmm.
Yeah. So at one point there was a change in the organizational leadership, and they're really into like putting Westerners or Western trained nurses in leadership positions. So I was demoted when they did restructuring just because I did not have Western training. I basically didn't have the right nationality for the role. It was so difficult for me. I think that was one of the greatest challenge that I've experienced in my career, just because I know that I really worked hard and I felt like I deserved that position. So I went into depression for almost a year. It wasn't major though. I mean, like, I would say that it was mild depression, but I felt like I started drifting away, just being aloof and did not even participate. But one day I woke up and realized, Dale, that if I'm gonna keep continuing on that mindset, nothing will happen to myself and my career. So started talking to some of the senior nurses who has gone through some sort of the same experience. Well, started reading self-help books, and then started listening to podcasts as well, motivational podcasts. And then I realized that, yeah, I think I need to reevaluate my plans for myself. Like, if this is not working for me, I maybe need to rethink another pathway. And that is when it clicked to me that I was passionate with education as well. Because when I was working in the Philippines, I really love precepting new nurses in the unit. I started looking for opportunities, and since I was still working at the same hospital, and there was an opening for a clinical resource nurse who's a tantamount to a nurse educator here. I asked them, and then they said that unfortunately, like, you're non-Western trained, so we cannot give you the role. But if you're willing, you can do an acting role while we are looking for the right person for the job. So I was like, okay, I'm gonna take it because I really just want to experience it and learn. Yeah. So I did it for almost a year, and then eventually they found a person to do the role. So for me, the person who came into the role was also a blessing for me because that person became my mentor, and I was sort of became her mentor as well. So it was sort of like a symbiotic relationship. Yeah. And so eventually that was the time as well that I became so active in LinkedIn, because I've realized that if you do not tell people what you are capable of, you will always be siloed and you will always be labeled as someone, you will always fit into a stereotype. So I said that, I'm going to put whatever I'm doing in LinkedIn so that people will know that I'm capable of doing this. And it's not even about bragging. And it's not about boasting, but it's really just showing that I'm a nurse who has the experience, who has the capability of doing something, and I can actually make an impact. I am capable of doing something. And it did work out for me. So another hospital, a new hospital, saw my LinkedIn post, and they were at the time looking for an educator. So they hired me for the role, and I moved to that hospital and worked really hard in there, still kept posting things on LinkedIn. It so happened that my old organization saw how active I am, and they had a change in leadership again. And this time, the leader of my previous organization has a different mindset. Like he said, like, I'm gonna hire people who can do the job. They called me up, and then I said that I would be happy to go back, because I really love working with the people as well that I've worked before.
Mm-hmm.
But I should be paid for the role, not because of my nationality. Because one thing that I'm not so sure if I mentioned, Dale, is that there's a difference in pay for nurses there depending on the nationality.
Wow.
So yeah, so like both of us are nurses, and if you come there as an American nurse, me as a Filipino nurse, you will be paid twice or three times my salary.
That much.
Yeah.
Wow.
Yeah. So that was one of the fights that I did. I said, like, you have to pay me the salary for the role, not for my nationality, because you're going to be asking me to do things for the role. And I did. They said yes to it. So I was like, I went back. But all the while as well, before going back to the organization, I also sort of listened to them. I listened to the feedback that you don't have. What I learned was that my limitation came from being non-Western trained. So I started getting some certifications from the US, did some postgraduate certificate in the United States, so that they cannot tell me that I don't have Western qualifications.
Right.
It's really about listening to the feedback, not giving up, and working hard. So those are one of the main challenges that I had in the Middle East. And when I moved to the US, I would say the challenges is the weather was one thing. Dale, I'm trying to survive the winter here in Boston. I didn't know that Boston it can be so cold. Like, coming from the Middle East, coming from Dubai, and coming from the Philippines, which is a tropical country, to move to the East Coast, I was like, oh my God, I'm not so sure if I did the right decision, but I'm happy here in Boston, except for winters. And I guess one of the main difference and challenges that it's very different culturally. One thing that I've noticed here is that well, if not all, most of the people here in the US are so focused in their work that sometimes there is a tendency that they might forget about self-care. Yeah, like you work behind hours, like I was like, oh my God, this is like a very hardworking group of people, but I wish that they also provide time for themselves. I'm still trying to learn and navigate that, setting that boundary between work and personal time, because I want to take care of myself, Dale. I don't want to get burned out. I want to work. I love what I'm doing, but I also love myself.
Okay. I'm so happy that you brought that up because you're right. We do that. We do that. And particularly as nurses, where the opportunity to come to work, if I wanted to, I could work 365 days a year.
I know.
So since you brought up self-care, what does self-care mean to you? What do you do for self-care?
For me personally, I think self-care is really knowing your priorities and setting that boundaries and the limitations so that you protect your personal time, and be productive at your personal time. And productive, I mean by productive, I mean that you're productive for yourself, not for the organization that you work, because you will have your working hours. So you should be productive for your work during your paid working hours, but the rest, it should be for yourself and for your time, and by productive, it could be sleeping. Like sleeping will be productive for you because that will and reset yourself, amongst many other things, of course, like, whatever you love doing. So that's my definition of self-care.
I love that you use the word boundaries, because many of us don't, our boundaries are very shifting. And I think that you really have to be firm in your boundary. Sometimes you have to give a little, but you really have to know what your boundaries are and work within them. Yeah. So, having gone through all of this, I was going to ask you, what advice would you give to somebody who wants to be a nurse? But what advice would you give to somebody educated overseas, traveling to the United States as a nurse? What advice do you have for them?
So for the nurses who are coming from overseas, I think the main thing that I can say is really for them to prepare themselves. It's a very different setting, different healthcare environment, different equipment, the processes is just very different. So it does really help for them to have a know-how before they come here, so that they will
Yeah.
not be just shocked when
Yeah.
when they come and start working. And there's a lot of opportunities, or there's a lot of platforms where that can happen. Like
Yeah.
there are a lot of nurses who are here that they can ask. There are a lot of programs, transition to practice programs, that can help them out. So yeah, just be ready. I would not say for them to just come here without even researching. Like even myself, I didn't research a lot about Boston. So now I'm learning how to live in a cold place. But yeah, be ready.
Be ready. I get that. I get that. Like you, I did not become a nurse in the United States. I have also worked in 3 different countries, and I can get you think as a nurse, well, nursing is nursing. Well,
Yeah,
yeah, nursing is nursing, but in different countries and even in different institutions in the same country, in the same state or same city, depending on where you are, what is required of you as a nurse, what is expected of you as a nurse may very well be different.
exactly. Yeah, I
Yeah.
totally agree with that. Yeah, I think the general concept of nursing itself, which is caring, is the same.
Mhm.
It's universal.
It's the same. Mhm.
The way it's being delivered, the way you care for patients, will have specific variations in each of the places or the
Yeah,
countries that you're going to be
yeah,
working.
exactly, exactly. Yeah. So, what would you say if you had to describe what is for you the most essential quality of a nurse in just one word? What would that word be?
I would say compassion.
Compassion. Okay. I get that a lot. I get
Yeah,
that a lot. Mhm.
it's very important, and I feel like with the advent of technology, with all the changes that we are experiencing right now in our healthcare landscape, and I'm not saying that nurses are not compassionate anymore, but I would say that I think there's lesser compassion as how it was being done. We are just so focused in doing the job. At least that's what I'm seeing. My honest
Mhm.
opinion,
Mhm.
what I'm seeing in healthcare now. Like we are so focused on completing our documentation that we spend more time with computers than spending time with our patients. Um, or at least that was my experience, because I was forced. It's not that I was forced to document, because I have to document, but it's just that there's a lot of things that you have to
Yeah.
do, administrative tasks, as opposed to like patient care time.
Yeah, yeah, yeah. The current healthcare environment, I say, forces us into a kind of defensive nursing
Yeah,
kind of thing.
yeah, I think that's the best term actually. Yeah,
And that I don't know if that's healthy for either us or our patients.
I agree.
As an educator, this is your passion now. What would you like to see um added or taken away from the current education of nurses?
Um, I would say what I want to be added is actually having sort of like a platform for us to share knowledge, evidence-based practice, and educational technology beyond our borders. I think that will really help us. Whatever we have here in the United States, for example, if we share that to the countries who has less access to this type of resources, I think that will empower our nurses globally. And that
Mhm.
will then ensure that, like if there's some type of calamities wherever
Yeah,
we are then assured that all of us, wherever we come from, then we will be able to sort of deliver
yeah.
a standard way of
Standard care. Mhm.
standard care of, standard care for patients. So yeah, that's one thing that I would want to be added. One thing that I would want to be regulated in nursing education is the use of AI and technology. I love that we have that opportunity to tap into artificial intelligence. Um, I'm just a bit scared that having a lot of this artificial intelligence, especially for our nursing students, might remove their ability to critically think about their patients. And you might have heard of Chat GPT and other
Yeah.
AI tools,
Mhm.
wherein you
Mhm.
input something, they give you what you want. But
What you
to me, like if nurses will just get anything from the computer and they don't think through the things that they have, the data, information that they gathered from the patient, that will impact their critical thinking and their clinical judgment. So I'm just a bit scared if that's not limited or if that's not regulated. But I do love that we have that opportunity because it also helps educators actually, like, you know, when you create exams, it helps you structure your exam in a proper way. So yeah, just regulation in a way, not remove, but regulate.
Yeah, I can see I can see that. And also it's you talked about it affecting the critical thinking part of it because it really does. And it can remove the human, it makes it a little harder for you to be holistic in your care. It can, I should say. And not necessarily well, but it can make it a little harder for you to be holistic in your care.
Agree.
So before we go, is there any little gem you'd like to leave us with?
I think what I would say, and this is based on my experience as a nurse, having moved to different parts of the world. What I would like to say to everyone, nurses, healthcare professionals, is that believe in yourself and don't be limited by what others think of you, because you are capable, you are empowered, you are destined to make an impact and to make the necessary changes within your environment.
Awesome, awesome, awesome. Thank you so very much. On that note, thank you very much for this. I've truly enjoyed this conversation. Thank you.
You're most welcome, Dale. I'm so grateful as well. Thank you for having this platform and for this opportunity, because I believe that, you know, this will really make an impact to the fellow nurses who will be listening to this podcast. Yeah.
Thank you.